The first Ebola patient diagnosed in the United States took a turn for the worse on Saturday, slipping from serious to critical condition in a Dallas hospital, as health officials reported tracking scores of possible cases around the country that proved to be false alarms. The case of Thomas Eric Duncan, who arrived from Liberia 2 weeks ago, has heightened concerns that the worst epidemic of Ebola on record could spread from West Africa, where it began in March, and has taken more than 3,400 lives. Health officials said Saturday that they are still monitoring about 50 people who may have had contact with Duncan for signs of the deadly disease. Among those are 9 people who are believed to be at a higher risk. Thus far, none have shown symptoms. Duncan was staying with Tro at a Dallas apartment when he became ill on Friday. A hazardous materials crew hauled out items from the apartment in industrial barrels for permanent disposal. That same day, Tro, originally from Liberia, and 3 others, her 13-year-old son, Duncan's distant relative, and a family friend, were moved to a private residence where they are being carefully monitored. The city had trouble finding a place to take them until a volunteer offered the private residence. In New Jersey on Saturday, CDC agents in biohazard suits removed a sick passenger and his daughter from a United Airlines jet that landed at Newark Liberty International Airport, but local media said the man was not believed by federal health officials to have Ebola. The passenger, who was vomiting during the flight from Brussels, was escorted off the plane and taken to University Hospital in Newark, accompanied by his daughter, according to a spokeswoman for the Port Authority of New York and New Jersey, which runs the airport. The virus that causes Ebola is not airborne and can only be spread through direct contact with the bodily fluids, blood, sweat, vomit, feces, urine, saliva, or semen of an infected person who is showing symptoms. The hospital issued a news release late Friday saying that the doctor who initially treated Duncan did have access to his travel history. After all, it had said Thursday that a flaw in the electronic health records systems led to separate physician and nursing workflows, and that the doctor hadn't had access to Duncan's travel history.